Imagine a world where ancient surgeons used gold and bitumen to recreate human sight. This 5,000-year-old mechanical eye, found fused to the skull of a priestess, is forcing us to rewrite every history book. Peer into the socket of a woman who carried the world's first biomedical miracle into the afterlife. In the windswept plains of southeastern Iran, where the modern Sistan desert stretches toward the Afghan border in shimmering waves of heat, lies the archaeological site of Shahr-e Sukhteh, a Bronze Age metropolis whose very name, the Burnt City, evokes destruction layered upon ambition. Flourishing between approximately 3,200 and 1800 BCE, Shahr-e Sukhteh was not an isolated desert outpost, but a major urban center strategically positioned along trade arteries that connected Mesopotamia to the Indus Valley civilization, allowing ideas, materials, and technologies to circulate across vast distances long before the classical world emerged. Excavations beginning in the 1960s gradually revealed an unexpectedly complex settlement. Multi-room houses constructed from mud brick, specialized craft workshops, advanced metallurgy, evidence of textile production, intricate pottery, including one of the earliest known examples of sequential animation, art, and burial grounds organized in structured cemeteries reflecting social differentiation. This was a city with hierarchy, specialization, and sustained economic exchange, not a primitive village fumbling toward complexity. It is within Cemetery 6 of this vast necropolis that tomb 6705 was uncovered, containing the skeletal remains of a young woman estimated to be between 25 and 30, years old at the time of her death, whose nearly 6-foot stature immediately marked her as physically exceptional within her population. Her grave goods, including ornamental beads and personal items, indicated a position of status rather than anonymity, and her burial posture suggested care and deliberation. Yet it was not her height or adornments that froze archaeologists in place. It was the moment when sand was brushed away from her skull and something dark and rounded appeared within the left orbital cavity, aligned so precisely that for a fleeting second it created the illusion of life staring back. From 5 millennia of silence, what emerged was not stone, not shell, not decorative debris dislodged by time, but a carefully shaped, hemispherical object fused into the socket itself. The hyper-arid climate of the Sistan Basin had performed a rare act of preservation, halting decay that would have erased softer materials elsewhere, allowing bitumen to harden without disintegration and gold threads to resist corrosion. Laboratory examination confirmed that the object was an artificial ocular prosthetic, the earliest known example in the archaeological record, dating back nearly 5,000 years. The implications of this discovery extend far beyond curiosity. They disrupt deeply rooted assumptions about the trajectory of medical innovation, because conventional narratives often place the beginnings of surgical sophistication within later Mediterranean civilizations, particularly classical Greece and Rome. Yet here, in a Bronze Age Iranian city predating those cultures by millennia, we find evidence not merely of craft artistry, but of anatomical awareness and biomedical intervention. The Burnt City was already known for surprising finds, a carved game board that suggests early strategic play, cosmetic containers indicating aesthetic consciousness, and trade goods revealing expansive networks. But the mechanical eye introduced a dimension of intimate human engineering that forces us to reconsider what urban societies of this era were capable of achieving. It tells us that Shahr-e Sukhteh was not simply a participant in early urbanization, but a center where experimentation, specialization, and adaptation flourished. The desert did not just preserve a body. It preserved a moment when ancient hands shaped matter to restore appearance, perhaps identity, and possibly authority to a living person. As researchers cataloged the find, they realized that this was not symbolic ornamentation inserted for burial theatrics, but a functional device worn in life, a conclusion that would only grow under microscopic analysis. In that realization, the Burnt City transformed from archaeological site to intellectual crossroads, because the presence of a prosthetic eye implies medical procedure, technical planning, and social motivation powerful enough to justify surgical risk. It forces us to widen our lens beyond stone monuments and pottery shards to the fragile domain of bodily intervention, where innovation touches human vulnerability directly. The story of this woman, tall, carefully buried, and equipped with an engineered eye, begins. Not with myth or exaggeration, but with sand, bone, and material science. And it challenges the comfortable belief that early civilizations lacked the curiosity or competence to modify the human body with deliberate precision. Beneath the desert wind, 5,000 years ago, someone dared to replace sight with craft, and that act alone reshapes the boundaries of what we thought possible in the Bronze Age world. The artificial eye recovered from tomb 6705 at Shahr-e Sukhteh is often described simply as a prosthetic, but such a label risks understating the layered technological decisions embedded within its construction, because this object is not merely shaped material, but the outcome of deliberate experimentation in chemistry, metallurgy, anatomy, and aesthetic realism, each component reflecting knowledge accumulated within a society already proficient in craft specialization. Scientific analysis determined that the core of the prosthetic consists of natural bitumen, a hydrocarbon compound, abundant in parts of the Near East, and widely exploited in antiquity for waterproofing vessels, sealing baskets, and binding construction materials. Yet, in this case, bitumen was not applied as adhesive or sealant, but molded into a hemispherical form approximating the curvature of a human eyeball. The transformation of bitumen from construction material to biomedical medium required more than opportunistic use. It demanded recognition of its moldable properties when heated and its rigidity once cooled, as well as its relative resistance to decay in arid climates. However, pure bitumen would have produced a brittle, uneven, and visually flat surface, so evidence suggests it was mixed with animal fat to create a smoother texture and subtle sheen that better replicated the moist reflective quality of a living cornea. This blending process implies empirical experimentation, because achieving the right ratio would require repeated heating, cooling, and testing to prevent cracking while maintaining structural stability. The finished prosthetic, measuring roughly 2.5 centimeters in diameter, demonstrates a curvature closely aligned with average human ocular dimensions, suggesting it was crafted with attention to anatomical proportion rather than abstract symbolism. The most visually striking detail lies in the gold threads engraved or embedded upon the surface, arranged in radial patterns that mimic the complex striations of a human iris. These threads were not decorative flourishes randomly applied, but carefully positioned to imitate biological structure, revealing a keen observational understanding of how the eye appears under light. Producing such fine gold filaments required advanced metallurgical skill, including hammering gold into extremely thin wires capable of being bent and inserted into shallow grooves without fracturing. And gold's natural resistance to corrosion made it an ideal choice for long-term wear within a bodily cavity. The prosthetic also contains two lateral perforations, tiny holes drilled through opposite sides of the sphere, which served as anchoring points for gold wire used to secure the device inside the orbital cavity. These perforations transform the artifact from static ornament to functional mechanism, because without a method of attachment, the prosthetic would shift or fall out during movement. The placement of these holes suggests planning in advance of insertion, indicating that the artisan anticipated how the rice would interact with soft tissue and required stabilization. Crafting such perforations in hardened bitumen without splitting the material required precise drilling or piercing techniques, likely performed when the mixture was partially cooled but not yet fully hardened, highlighting a controlled fabrication sequence. Reconstructing the manufacturing process step by step, one can imagine bitumen gathered and purified, heated in a controlled fire environment, blended with animal fat to achieve workable viscosity, then shaped, possibly by hand or using a mold, into a hemisphere matching ocular curvature, once cooled to semi-solid. Consistency, grooves would be incised into the surface to receive gold threads, which were carefully embedded to form the iris pattern, after which lateral holes were pierced to allow for future anchoring. The final surface would then be polished to achieve a reflective finish, perhaps using fine abrasives or smooth stones, enhancing the illusion of life Such a production chain implies workshop specialization within Shahr-e Sukhteh, a city already known for advanced bead-making, metallurgy, and decorative crafts, suggesting that the same skilled artisans capable of precision jewelry and cosmetic tools could adapt their expertise to biomedical application. What elevates this object beyond mere craftsmanship is its integration of aesthetic realism with mechanical necessity. The sheen created by animal fat enhanced lifelike appearance. The gold threads simulated anatomical detail, and the anchor holes ensured functional stability, combining visual deception with structural engineering. In modern prosthetic design, similar priorities persist: realism, fit, anchoring, and material durability, demonstrating that while materials have evolved, the conceptual blueprint remains strikingly consistent. The eye from the burnt city is therefore not a primitive precursor but an early embodiment of prosthetic principles still recognized today. It stands at the intersection of art and medicine, where the human impulse to restore wholeness converges with technical ingenuity. By the time researchers completed their compositional analysis, it became increasingly difficult to maintain the outdated assumption that Bronze Age societies operated solely within the realm of rudimentary survival. Instead, this object reveals a culture capable of repurposing industrial materials for intimate anatomical use, blurring the boundary between artisan and surgeon. The artificial eye is not only evidence of creativity, but of problem-solving under constraints, crafted without synthetic polymers, precision instruments, or sterile environments, yet achieving a form and function that resonate across millennia. In its dark, polished surface, we see not superstition but applied knowledge, not accidental shaping but deliberate engineering, and the deeper we examine its anatomy, the clearer it becomes that this device was conceived through observation, iteration, and confidence in the capacity to intervene within the human body. It is a machine in the truest ancient sense, an object constructed to perform a specific task within a living system, and its survival forces us to expand our understanding of technological imagination in the early urban world. If the artificial eye itself demonstrates material sophistication, the skeletal evidence preserved in the left orbit of the woman from Shahr-e Sukhteh provides the decisive proof that this was not a funerary prop placed after death, but a prosthetic worn in life. And it is within the subtle architecture of bone that the most compelling testimony survives. Detailed osteological analysis revealed smoothing and microabrasions along portions of the orbital rim consistent with repeated mechanical contact, patterns that cannot form from a single insertion at burial, but instead require prolonged interaction between rigid material and living tissue. Bone is dynamic. It responds to stress, pressure, and friction by remodeling, and the orbital cavity in this case bears traces of adaptation, indicating that the prosthetic rested within the socket long enough for the skeletal margin to record its presence. This alone confirms survival beyond the initial fitting procedure. Yet the evidence goes further, for localized signs of inflammation and abscess formation near the orbital cavity suggest chronic irritation and possible infection, revealing that the interface between artificial bitumen sphere and biological tissue was medically precarious. The presence of such abscesses tells us two important things. First, that the device was indeed worn for a sustained period, and second, that the wearer endured discomfort and risk rather than abandoning the prosthetic. To appreciate the magnitude of this intervention, one must consider the anatomy of the orbit, a cavity bounded by thin bones and housing not only the eyeball, but also muscles, connective tissue, vascular structures, and sensory nerves. The loss of an eye in antiquity, whether due to trauma, congenital condition, or disease, would have left exposed tissue vulnerable to infection, and the decision to insert a rigid device into that cavity would have required careful handling to avoid fatal hemorrhage or sepsis. The absence of catastrophic bone trauma suggests that the initial removal or loss of the eye did not shatter the orbital structure, implying controlled extraction or post-traumatic healing before prosthetic insertion. Although no written surgical manuals survive from Shahr-e Sukhteh, ancient Near Eastern cultures were not devoid of medical knowledge. Evidence from Mesopotamian cuneiform tablets and Egyptian papyri indicates familiarity with wound treatment, bandaging, herbal remedies, and even basic surgical interventions, suggesting that regional knowledge networks may have supported practitioners capable of performing delicate procedures. The insertion of the prosthetic likely involved cleaning the orbital cavity, managing residual tissue, and threading gold wire through the lateral perforations of the artificial eye to secure it to surrounding soft structures, anchoring it without drilling into bone and thereby minimizing skeletal damage. Anesthesia in the modern sense did not exist, but plant-based sedatives, fermented beverages, or opiate derivatives could have been employed to dull pain, while natural antimicrobial substances such as bitumen itself, copper compounds, or resinous plant extracts might have been used in attempts to reduce infection risk. That the woman survived long enough for bone remodeling to occur indicates that the procedure did not result in immediate fatal complications, and while the abscess evidence demonstrates that infection was present at some point, it was not severe enough to cause rapid death. Instead, we see a picture of adaptation, of a body negotiating the presence of foreign material, responding through inflammation and gradual accommodation. The mechanical eye was not seamlessly biocompatible. It irritated, pressed, and perhaps inflamed. Yet it remained in place. This persistence implies social or personal motivation powerful enough to outweigh discomfort, suggesting that the prosthetic served a role beyond mere cosmetic concealment. The medical risk undertaken underscores the seriousness of the intervention. This was not an ornamental bead tucked casually into a socket, but a carefully fitted device that required anatomical knowledge and patient endurance. When viewed through the lens of surgical reconstruction, the Burnt City prosthetic becomes a case study in early biomedical courage, where practitioners navigated the boundaries of their understanding without sterile tools or antibiotics, relying instead on experience, tactile skill, and empirical observation. It is possible that the initial loss of the eye occurred years before death, allowing scar tissue to stabilize before prosthetic fitting. Alternatively, the prosthetic may have been introduced after healing from trauma, suggesting staged treatment rather than emergency improvisation. Either scenario reflects a society comfortable with bodily intervention, rather than fearful avoidance. What emerges from this analysis is not romantic exaggeration, but grounded evidence of medical practice embedded within an urban Bronze Age context. The orbital bone does not lie. It records friction, pressure, and inflammation with silent precision. And what it records here is astonishing. A human body that accepted, resisted, and ultimately accommodated a mechanical device engineered to replace what nature had taken away. In that darkened socket lies proof that ancient surgeons, artisans, and patients were willing to test the limits of their world, blending craft with anatomy in pursuit of restoration, identity, or authority. The survival of this woman after such an intervention challenges modern complacency about the fragility of early medicine and reminds us that innovation often emerges not from abundance but from necessity, guided by hands steady enough to risk operating where life and death intersect. To understand the full meaning of the mechanical eye discovered at Shahr-e Sukhteh, we must move beyond the surgical and technical dimensions and enter the social and symbolic world of the burnt city, because in ancient urban societies, bodily modification rarely existed in isolation from belief, hierarchy, and power, and the presence of such a striking prosthetic would have shaped how this woman was perceived within her community. Shahr-e Sukhteh was not merely a settlement of farmers and craftsmen, but a complex urban center integrated into long-distance trade networks linking Mesopotamia, Central Asia, and the Indus Valley. And archaeological evidence reveals a structured society with occupational specialization, material wealth differentiation, and distinct burial customs that indicate varying social ranks. The woman in tomb 6705 was not interred anonymously. Her grave goods suggest elevated status, and her exceptional height alone would have set her apart physically in a population where average stature was significantly lower. In ancient societies, visible difference often translated into symbolic meaning, and an artificial eye lined with gold threads would have created an unforgettable presence. One eye natural and responsive, the other dark, polished, and unblinking, reflecting firelight. Differently, catching sunlight in metallic glints could easily be interpreted as evidence of supernatural vision. While no inscription names her a priestess or oracle, scholars have cautiously proposed that the prosthetic may have reinforced a ritual role within the city's spiritual framework, because throughout ancient cultures, physical anomalies or modifications frequently became markers of divine favor or spiritual authority. The burnt city has yielded artifacts suggesting ritual and symbolic practices, including figurines and carefully arranged burial goods, implying that cosmological belief systems shaped daily life. Within such an environment, a woman bearing a golden mechanical eye might command attention not simply as an individual, but as an intermediary between human and divine realms. The visual power of the prosthetic cannot be underestimated. The gold iris threads would shimmer subtly in shifting light, creating the illusion of depth and vitality within the dark sphere, while the absence of blinking would lend her gaze an intensity bordering on the uncanny. In pre-literate societies where charisma and spectacle carried political weight, appearance could become authority, and an engineered eye might transform perceived disability into enhanced identity. If she occupied a ritual or advisory role, perhaps presiding over ceremonies, offering interpretations, or mediating communal decisions, the artificial eye would amplify her presence, distinguishing her from ordinary citizens and reinforcing narratives of special insight. The discomfort and infection risks associated with wearing the device suggest that it was valued highly enough to justify physical endurance, indicating that its social or spiritual benefits outweighed medical drawbacks. A leather pouch discovered among her burial goods has led some researchers to hypothesize that it may have served as storage or protective casing for the prosthetic when removed, though this remains debated. If true, it would imply maintenance routines and conscious care, reinforcing the idea that the eye was integral to her identity rather than incidental adornment. Within the hierarchical structure of Shahr-e Sukhteh, where artisans, traders, and possibly ritual specialists operated in defined roles, the prosthetic could function as a symbol of elevated status, transforming personal injury into visible distinction. It is also plausible that the community itself invested meaning in the device, interpreting her altered gaze as evidence of contact with unseen forces or heightened perception, especially in a cultural landscape where celestial observation and ritual symbolism were intertwined with governance and social order. Yet we must avoid romanticizing without evidence. The archaeological record does not grant certainty regarding her exact role, and it is equally possible that the prosthetic served primarily aesthetic or personal purposes. Nevertheless, the convergence of medical intervention, gold detailing, burial privilege, and survival after implantation strongly suggests that this was not a marginalized individual, but someone whose appearance mattered within the fabric of urban life. The mechanical eye thus becomes more than a biomedical artifact. It becomes a lens through which we glimpse how early civilizations negotiated bodily difference, technological ingenuity, and social meaning simultaneously. In the burnt city, innovation did not operate in isolation from belief. It was woven into identity, authority, and community perception. The artificial eye allowed its wearer not only to appear whole, but perhaps to appear extraordinary, bridging the gap between vulnerability and power. In that fusion of surgery and symbolism, we encounter a society capable of transforming loss into spectacle, engineering into ritual, and anatomy into narrative, reminding us that technological advancement in the ancient world often carried cultural resonance as profound as its functional purpose. When the artificial eye from Shahr-e Sukhteh is placed within the broader landscape of Bronze Age civilization, its significance expands beyond a single remarkable burial and becomes a direct challenge to the conventional narrative that locates the birth of sophisticated medical engineering in the classical Mediterranean world. Because while ancient Egypt and Mesopotamia are often credited with early medical texts and procedural knowledge, and Greece and Rome are praised for formalizing anatomical theory. The prosthetic eye predates these systems in documented surgical realism and functional design by centuries, if not millennia. Mesopotamian clay tablets describe wound treatment and ritual healing, Egyptian papyri detail fractures and surgical bandaging, and later Greek physicians would articulate theories of bodily humors and structured anatomical observation. Yet none of these records contain a surviving physical prosthetic comparable in age and preservation to the burnt city eye. This discrepancy forces us to reconsider the assumption that written documentation equates to technological priority, because archaeological evidence often survives where texts do not, and material culture can reveal innovation that formal literature never captured. The burnt city existed within a web of exchange that linked it to the Indus Valley civilization and to Mesopotamian trade networks, suggesting that knowledge was not isolated but circulated across regions. Artisans and specialists likely shared techniques in metallurgy, textile production, and possibly medical practice. It is therefore plausible that the prosthetic reflects broader regional experimentation rather than isolated brilliance. Yet the absence of similar surviving examples from neighboring sites leaves us with a tantalizing gap. In Egypt, artificial toes made from wood and leather have been discovered dating to the first millennium BCE, demonstrating early prosthetic adaptation, but these appear centuries after the burnt city eye and lack the same degree of anatomical mimicry and embedded metallic detailing. Classical Roman medical writers later described surgical instruments and procedures, but by that point, nearly 2,000 years separate them from this Bronze Age innovation. The persistence of prosthetic principles across time, curvature matching, anchoring, mechanisms, cosmetic detailing suggests that the conceptual foundations of biomedical replacement emerged far earlier than standard educational timelines acknowledge. Yet, perhaps the most haunting dimension of this discovery lies not in its existence, but in its disappearance. Because after Shahr-e Sukhteh declined around 1800 BCE, destroyed by fire and gradually abandoned, the archaeological record does not present clear, continuous evidence of ocular, prosthetic craftsmanship at comparable sophistication for centuries. Civilizations do not always transmit knowledge seamlessly. Urban collapse, environmental change, and population migration can fragment expertise, leaving specialized techniques stranded in memory rather than preserved in widespread practice. The burnt city itself faced repeated destructive events, and as trade routes shifted and regional power centers transformed, the networks that once sustained craft specialization may have dissolved. When a city falls, its artisans disperse or perish, and with them vanish tacit skills never written down. The mechanical eye may therefore represent not the beginning of a continuous tradition, but a peak within a localized technological arc that rose and fell alongside its urban host. This pattern disrupts the comforting idea of linear progress, replacing it with a more fragile model in which innovation flickers, disappears, and reemerges independently across cultures separated by centuries. In this sense, the prosthetic becomes emblematic not only of early medical ingenuity, but of historical amnesia, reminding us that technological advancement is not guaranteed to endure. Modern prosthetic eyes, crafted from acrylic polymers and fitted with surgical implants in sterile clinics, follow design principles strikingly similar in intent: realistic appearance, structural fit, secure anchoring, yet we rarely trace that conceptual lineage back to Bronze Age Iran. The burnt city eye forces that connection, demanding that we acknowledge a deeper antiquity to biomedical imagination. It also invites humility because it demonstrates that societies we once labeled primitive possessed observational acuity and experimental courage sufficient to reshape the human body deliberately. By situating this prosthetic within the continuum of ancient medical practice, from Mesopotamian wound care to Egyptian splinting, to later Greco-Roman surgical instrumentation, we recognize that innovation did not originate from a single cultural epicenter, but emerged in multiple regions where urban complexity fostered specialization. The artificial eye is thus not an anomaly, but a testament to the distributed genius of early civilizations, its apparent disappearance after The burnt city's collapse does not negate its significance. Instead, it underscores the vulnerability of knowledge to environmental and political upheaval. When we examine the prosthetic in this comparative light, it ceases to be a curiosity and becomes a pivot point in the history of medicine, repositioning bronze age on within the global narrative of human ingenuity. The woman who wore it stands as a reminder that advanced thought is not bound by geography or epoch, and that our modern sense of progress may obscure earlier peaks of innovation that rose, flourished, and faded long before classical antiquity claimed intellectual dominance. The story of the mechanical eye is, therefore, both expansion and warning. Expansion of our timeline for biomedical creativity, and warning that without preservation and continuity, even the most extraordinary knowledge can dissolve into silence, awaiting rediscovery beneath desert sands thousands of years later. When we step back from the laboratory analysis, the osteological reports, and the comparative timelines, what remains is a human presence that refuses to fade. A woman from Shahr-e Sukhteh, who lived nearly 5,000 years ago, and whose altered gaze still confronts us across the gulf of time, challenging not only our understanding of ancient medicine, but our assumptions about the arc of human ingenuity itself. The mechanical eye does not merely expand a footnote in surgical history. It demands a recalibration of perspective, because it proves that early urban societies were capable of combining chemistry, metallurgy, anatomy, and aesthetic sensitivity into a single integrated solution to bodily loss. In that dark, polished sphere, we see a Bronze Age community unwilling to accept disfigurement as final, willing instead to intervene materially in the human form to engineer restoration where nature had failed. Yet the most unsettling dimension of this discovery lies not in its sophistication, but in its solitude, for despite its technical achievement, the prosthetic appears as a singular beacon in the archaeological record. A moment of innovation that did not clearly propagate forward in an unbroken chain. The burnt city itself eventually succumbed to environmental shifts, fires, and abandonment. Its bustling workshops silenced and its knowledge scattered. With its decline, whatever local expertise enabled the crafting and fitting of the artificial eye may have dissipated, absorbed into migration, diluted through generational loss, or extinguished entirely. This fragility of continuity disrupts the comforting narrative that civilization steadily accumulates knowledge in a straight ascending line. Instead, it reveals that progress can be episodic, vulnerable to collapse, and dependent on the survival of communities that nurture specialized skills. When we credit later civilizations as the pioneers of biomedical practice, we risk overlooking earlier peaks that flickered briefly and then vanished. The artificial eye thus becomes more than an artifact. It becomes a meditation on historical memory itself. It reminds us that technological brilliance does not always leave a clear paper trail, that not all innovators write treatises, and that material evidence can outlive intellectual tradition. The woman who wore the prosthetic likely did not consider herself a milestone in medical history. She may have sought dignity, authority, or simple wholeness in daily life. Yet her survival after surgical fitting, her endurance through irritation and infection, and her burial with the device intact, transformed her into an unwitting messenger across millennia. Her gaze, one natural eye and one engineered sphere, symbolizes the dual nature of humanity, biological vulnerability paired with creative resilience. In modern clinics, ocular prosthetics are shaped from advanced polymers under sterile lights. Yet the conceptual heartbeat of those devices echoes the bitumen gold innovation of the burnt city. The materials have evolved, the techniques refined, but the impulse remains unchanged: to restore identity, to soften loss, to assert control over bodily fate. And here, in the desert of southeastern Iran, we find that impulse alive. 5,000 years ago, the mechanical eye forces us to confront a humbling truth. We have underestimated the past, not because it lacked intelligence, but because it left us fewer written explanations. The archaeological record is fragmentary, and yet in that fragmentation lie revelations capable of reshaping textbooks and recalibrating pride. If a Bronze Age city could produce such a device, what other biomedical experiments, innovations, Or adaptive technologies once flourished and disappeared without trace? How many peaks of ingenuity lie buried beneath layers of sand, ash, and time, awaiting rediscovery? The eye from Shahr-e Sukhteh stands as both evidence and warning. Evidence that ancient societies possessed far more technical capacity than traditionally credited, and warning that knowledge, no matter how advanced, can fade when the structures supporting it collapse. As we conclude this journey, the image that lingers is not one of myth or exaggeration, but of quiet human determination. A craftsperson shaping heated bitumen with careful hands, a surgeon threading gold, wire with steady precision, a woman standing before her community with one eye that reflected the world as it was, and another that reflected what human ingenuity could make it appear to be. 5,000 years later, that engineered gaze still confronts us, asking whether we are ready to see the past not as primitive prelude, but as complex and capable in its own right. In the end, the greatest revelation is not that ancient surgeons recreated sight with gold and bitumen, but that we have only just begun to recognize how clearly they saw.